As you said, my name is Michael Wynn. I'm the Director of Community Programs for Grace Health. We are a federally qualified health center located in southeastern Kentucky. And this is my second time to speak before this board. And I really sat here today just amazed and grateful to be from the state of Kentucky, because the work that you're doing here, you're already discussing and healthy debate on topics that are very near and dear to our heart and that impact our patients. So I appreciate that so very much. As a leader working within a community health center in southeastern Kentucky, I do feel that deep responsibility to speak of the real world impact that the proposed changes in House Bill 2 would provide, which include maybe possibly funding cuts beyond minimum mandatory copays for low-income patients, and the significantly stricter reporting requirements that would have on the people that we serve. I want to take a moment just to advocate or be a voice for a gentleman that we met just last week that you'll find maybe has impact for what's being discussed here today. One of the security guards at our clinic happened to see a man walking in the woods in behind our clinic. He followed him out into the woods and found out that he was living in a tent behind our health center. And so he goes in the clinic, grabs our community health worker. They sat with this man out in the woods to discuss his situation and entice him, maybe tempt him, pull him out of the woods into our health center. They were able to give him food. They were able to hand him over to a connector. They enrolled him in Medicaid. His coverage was active in that moment. He was able to see a primary provider that day. They also scheduled him with a behavioral health provider, and he's scheduled to enter into a recovery program, all because of the ability to access that program that day. And so because of that, Travis is what I thought was he was on the path to either an ER visit because of his health situations, or he was on his way to Knox County Jail. But because of that ability to access those services that day, because of the self-attestation component of Medicaid, he was able to get on the path to better health. So as we're sitting here today, this man's life has been impacted by these benefits. So for our region, Medicaid is not an abstract budget line. It is actually a lifeline that allows children to receive preventative care, working families to manage chronic conditions, and older adults to remain stable and independent. In communities like ours, where poverty rates are higher and access to transportation, specialty care, and private insurance is limited, Medicaid fills a gap that no other system can. Changes that go beyond the reasonable program integrity measures would not simply reduce spending, they would reduce access to primary care, to behavioral health services, to dental care, and to life-sustaining medications.
Mr. Winfield, sorry to interrupt you. We're already over about 45 seconds, so if you have like one or two more sentences, I would appreciate that.
Okay, let me just go to the back. Again, we appreciate the work that you're doing, and let you know that the healthy debate that's happening is an inspiration I get to take back home to southeastern Kentucky and tell them about the work that's being done here. Thank you.